You can talk now, Dr.
Ah, finally. Yay, I got my voice back.
I didn't get to say.
You basically had me locked down.
Sorry. So sorry about that.
No worries, no worries. Yeah, once again, my condolences to you, Sister Toyo, on
Thank
the
you.
death, on the departure of all your loved ones. You've lived through something I've only lived through once, and I can tell you it's not pleasant. So, my condolences. Yes, I heard when you were talking about health caregivers, especially physicians in Nigeria, not being too attentive. Um, I'm not going to defend them because I'm not in Nigeria. I'm sorry to say. But I can only say that they are working with what they have. They're working with what they have. Physicians, doctors in Nigeria, when we leave Nigeria and we get to places like where I am, we're the bee's knees, as in we dazzle them. Amanda dazzle money. But it's a question of maybe some people are just not paying attention. I Because in my previous life I was a radiologist. I think that was the kind of doctor you were trying to remember when you were speaking earlier on. So I was a radiologist, and I just, my bread and butter was looking at all these X-rays and all the scans and being able to see when something is not right. Now, if people are not paying attention and if they're not really attentive, it's easy to miss things and just write them off as normal. So, but that is expensive. It is an expensive mistake if it is a mistake. So I can only just imagine what the little girl, your niece, went through. I really, pray that such a thing will not happen again. Um, that's just one thing. But again, to kind of corroborate what you have said, yes, we women basically we just soldier on, and I have to raise up my hands, and I have some lovely friends on the call, some of my colleagues who are also doctors, and people who I attended secondary school to who are not doctors, but these are my homies. I can see you guys. Thanks for coming on.
Mhm.
I think for coming from Nigeria and that kind of environment where Nigeria is, we as women, we're just basically told to carry on. We don't have the culture of looking after ourselves, of resting, of having me time. But my kids nowadays, they know me. If I'm not going to cook, I'm not going to cook. You can't do anything. That's just it with me. If I'm not, if I'm ready to take time off, I will take time off. I'm learning to do that. I'm not 50 yet. So I'm trying to get into that habit of doing it so that, when I'm over that particular milestone point, it's not strange to me. It won't be strange to me. So we do need to take it seriously. But it's not just the women, also the men. A lot of our men don't open up when there are issues. And one particular cancer that affects men that they just don't tell, they don't pay attention to it is testicular cancer. And I'm begging every man that is on this forum here, on this call, please check down there by yourself. You're the one who knows what it feels like ordinarily. So if there's anything amiss, check it. Check, check, check. We can't overcheck. It's under checking we can do, you know, but we can never really overcheck. We can never be over attentive to ourselves. If people say, "Oh, you're a bit of a hypochondriac," yeah, let them call you names. But this is your well-being. This is your life. This is your health. You just need to be, you have to look out for your well-being, because as Sister Sawyer said, you don't want people observing 1 minute silence on the day when your kids or your loved ones are, having lovely occasions. So we just have to bear these things in mind and do them. So I hope that has helped people a bit more. Do we have questions? I'm happy to take questions. We're, about an hour into the program already. Sister Toyo, you're on mute. You're on mute. You're still on mute. You need to unmute. I don't know whether it's a laptop or the phone.
Yes, I just did. I just did. Thank you. Thank you. Yes, we have a couple of questions, but some of the ones that I'm going to take these questions in batches. What I've been able to gather so far. Someone asked, I'm going to take the questions in threes. Okay, I'll take it in threes. Then we'll have the doctor speak about them if there are things she can speak about, and if there are ones that I can answer, I will answer them. And then we'll move on to the next batch. So you can keep dropping questions in the chat room, please. The first question here says, is the issue in Nigeria education? Why I think this question was in reference in reference to the story I gave about the misdiagnosis. I think I'm right. The good doctor should please help me with that. So that's the first one. Is it an educational issue here in Nigeria? Then another one, the next question is, are we not equipped in Nigeria to detect this diseases, these cancers? And then the third question I'll pick here says, I don't think it's a question actually. I think it's just an observation that we should grow above spiritual attack storyline, which the good doctor already told us that we should do that. And then there's another question here. I'm sure this person is from out of the country. It says, does Nigeria not have a program for mammogram? Those are the questions. So maybe Dr. Tayo will take the first two, and then I think the mammogram one, since she's not here, she might not be able to take the questions. I'll take the one on the mammogram. Dr. Tayo, just a moment, I will unmute you in a... Sorry, peeps, I am the speaker, the technician, and the Gugwero.
Yes, thank you. Thank you. Yes. Yeah, multitasking, sis.
Yes.
Yeah. I think the first one was something asking about, whether Nigeria doesn't have
that is, if you can hear me, that is it the issue of education, lack of education? Why?
Oh, well, you Sister, you too, you can answer that one. I think you are also in a very good position. And I think, I don't want to say that it's an obvious, answer. So, because I don't want to make it sound like it's a silly question. It's not a silly question, please. So whoever asked that question is a very relevant question. Thank you very much. But the point is this: our society, despite all the exposure, social media, science, people go and Google stuff, In fact, I get tired because people go and Google stuff now before they even go to their doctors. Fine, it has its advantages, pros and cons. When you do that, I do it also. But the point is, we are still hanging on to things that we should have let go a long time ago. We're struggling with religion and culture and beliefs and science on one, on one side, and then science on the other side. And we still haven't found a way of being able to merge the two. And so for me, it's a question of people still not taking on board all the things they do know. People know things. Of course, we have the people in the hinterlands who have not really got this exposure and knowledge and information. And so that's why, primary care is very important. Primary care initiatives wherein healthcare practitioners go into the villages, they go into, all the places, where people don't have access to technology and everything, and to educate them. So yeah, a lot of things are actually they border around miseducation and misinformation, which is why I spoke at the beginning that knowledge is power. If you know the right stuff, if you have the right knowledge, you will be, able to take informed decisions. It's all about taking informed decisions. But if you're still living in the realm of, yeah, Lagbaja is doing me, That's the problem. That's one of the big problems. So I think that kind of addresses that particular question. I hope ask the person who asked is happy with that, and everybody else is. I don't know if Mr. Toyo has anything else to add. You're on mute, by the way.
Oh, okay.
Yeah, at least you're on mute on one of your devices because I can hear you.
Okay, yeah.
But you're showing up as muted.
Going so I can do all the multitasking I need to do.
Sure.
Yeah, I think you've answered that. The next question, part of the three that I threw at you is: are we not equipped in Nigeria to detect this cancers? And
I'll let you answer that one because you're there. I'm here.
Yes, exactly. I would like to say, I think I wouldn't say we are not equipped to detect the cancers. I really don't understand. Okay, just like the example I gave you, the equipment was there for my little niece, but the cancer was still missed. So I don't know if it's now education, because it's not the equipment per se. Maybe we don't have and I think the most up-to-date ones are someplace. So I don't think it isn't the equipment. It is, I don't even know. I'm sorry, I can't even answer the question.
Okay, let me come in there. I think it's a combination of all things. Yeah, the people who read the scan for that young lady who's passed on, unfortunately, I don't know whether he was actually a trained radiologist. But a trained radiologist, the chances that a trained radiologist would miss a lesion in a scan report, scan thingy right in front of them, is really slim. I'd be surprised. So the point is, maybe what was seen at that time in 2018.
Sorry, Dr. Tayo, Dr. Tayo, sorry, I'm going to butt in. The person that read it is a radiologist, and the person still practicing. He's not in the country anymore. He's now in Canada because I was planning to the guy.
Okay, right. Okay, now, so that's a different sphere entirely.
Still true. Yes.
But I was going to move on to another aspect. It could be that the actual machine or equipment that was used is not specific enough. And so what he saw did not appear to him as a lesion. But, if we look back at what you said, that the person in South Africa saw the same scan and said, oh, this is the lesion. And so now I have to put my hands up and say, I don't know. That indeed could be, if it was in the US, that guy will be sued. He'd be properly sued, So I can't speak for them. But I remember when I was in Nigeria, I left Nigeria in 2002, and we had just one CT scan in usage. The whole of Nigeria, I think, probably had 2 or 3 scans at that time. We had one angio suite where I used to assist my trainers then to do angiograms and all that. I had never seen an MRI until I came to the UK. So there I was studying and reading about MRI, Tesla 1.5, 2.0. I didn't have a clue what the thing would, what it looked like. So not until I got here did I get to know about how those machines actually work, what they look like, what they do. So I don't know what is happening now. But I think, bottom line is probably lack of adequate equipment and maybe not very good training also for the physicians that are, diagnosing people, that are in charge of diagnosing people. It's a shame indeed that misdiagnosis happens, but it can happen anywhere. It can happen anywhere. Misdiagnosis happens here too, in the Western world. So I think, again, the onus is on people to be vigilant. But how vigilant can a 7-year-old be? How vigilant can a 6-year-old be? And I'm sure the parents noticed something wrong with her, which is why they started, to take her around to the hospitals and everything. So it's just an unfortunate one. It's an unfortunate one.
Okay. Other questions. Now there's this question that says, okay, I think I can answer this. there's that it was one of the three that I put out earlier. Does Nigeria not have program for mammogram? We do. Some of us don't even take advantage of it, and it's in practically almost all hospitals. And that's why I said most of us here, we don't take care of ourselves. We don't take care of ourselves. And I am one because I've never had a mammogram.
I too. I've not had one.
Doctor, you have not had a mammogram.
I didn't need it. Me.
Okay, that's true.
Well, I mean, I don't know if I need it. I haven't found anything. Usually you would go for, because I don't think mammo is just something you actually go. It's not like a pap smear where people are brought in, at least not here in, where we are. It's usually like, if you've got a strong family history, you should consider it. If you find anything on self-examination, you should consider it. But I don't think ordinarily a mammogram is a routine test that people are called in for, as opposed to like a pap smear and a colonoscopy. I think that's the subtle difference in that kind of in that particular aspect. But yeah, if people don't take up all this available facilities wherever they are, if they're available, then really because the people who are going to do the scan, they won't be going into the houses to bring and drag people from their houses. It's up to us as individuals to, walk in and say, okay, I need this, or, or ask our primary care physician, our GPs, to recommend us and refer us.
Okay. The next set of questions, I'm going to take three more questions now, 3 questions for you to answer. It says, once women have screening, women have screening campaign on breast and cervical cancers, what is available to men?
Oh,
that's one question. The second question I'll take now is, how do we access other tests other than those on breast? Okay, that's what I have here. Then the third one is, how often is often for checkups, and can cancer show up between annual checkups? So those are 3 questions for you to answer. Move to the next one.
Okay, I will take them in reverse order. So how often is often? Well, it depends. It all depends on wherever you are. The screening programs that are available wherever we are. If you're in the UK, like I am, as I said, pap smears are offered, I think, 3 yearly if you're below 50. And then after that is every 5 years. What's that called now? What's the other one? Colonoscopies are offered, I think, every year for 50 and above annually. Mammograms, I don't know. I have to confess that I don't really know how often. If any of my doctor colleagues online, I would ask that if you know whether mammograms are being done annually, please help me out here. But I don't know how often it is being, recommended to be done. But I do know that there are certain reasons why you would be invited to, or, asked to go for a mammogram. That is if you find something, or if you have very strong family history. So that's that. Can cancer develop between one scheduled scan or test to another? Yes, it can. It can. And that's where I said, when I was presenting earlier on that, we all pray against this thing that you don't draw the short straw of life. If you draw the short straw of life, unfortunately, you could have your your screening test on 21st of August, and then your next one is due 21st of August next year, and suddenly cancer starts to develop, within those months. It's not impossible. And so we pray against it. What else do we do? But you also try and watch yourself and observe yourself, because there will be some changes. and it's part of being observant, you could actually pick it up before your next scan is due. The second question again, if you could remind me what that was.
How do we? Okay, the one about women having screening campaign on breast and cervical. What is available to men? And then,
yeah.
Okay, and then the third question was how do we? How do we do other tests other than those for breast?
Okay, all right. Okay, so the first one about what is available for men. What is available for men? Men can also do PSA. That's what you call prostate specific antigen. This is actually very good for men who might have positive family history of prostatic cancer. So like for instance, in my husband's family, I think there is a bit of a positive history. So he gets invited in to do a PSA every year. And so men can go in for that also. And they can request their doctors to refer them to have that done. There are scans that can be run also, just routine MRI scans, but I don't think they're run as screening tests per se, as the one, as the one women have for the breast and for the pap smear. So for men, it's all about just trying to be moderate in everything, drink in moderation, smoke in moderation, or if not at all, don't even smoke. And, try to keep healthy, keep active, and observe yourself. If there's anything that just feels wrong, don't underestimate it. Don't take it for granted. Go in and get checked. It's simple, but not so simple. And what else can we do beside breast screening tests? There are some other things, but they become a bit more specific. And so that's where we leave the realm of screening, and you then go into early diagnostic tests, wherein you're actually dealing on a one-on-one basis with a particular person, as opposed to screening, which I said earlier on, actually focuses on a group of people that are potentially at risk of a particular kind of cancer. So it's there are a number of them, different antigen tests. The common one for breast, apart from the actual mammogram, is testing a particular gene, the BRCA, I think 1,2 something gene, which is commonly found in, family members, and that could predispose them to developing breast cancer. I mean, I've read about sisters who actually have gone in for voluntary mastectomies because they have very positive family history. And then when they got tested for this gene, they had the gene, and they have gone to remove their breasts. Even before anything started to develop, they've gone in to have voluntary mastectomy. That is a radical decision, but if push comes to shove, if people want to do that, it's not impossible. It's not impossible to do. But obviously in Nigeria, those kind of decisions are not taken lightly. You don't take such a decision very lightly, because then you now have to go for cosmetic surgery to rebuild, new breasts for yourself, blah, 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 blah. So it is quite convoluted, but there are other tests apart from the actual just mammogram. Ultrasound scans can also be done for like the cervix, but they're not very specific. You can actually do transvaginal scans also, which are more specific, and actually you can visualize the area better than abdominal ultrasound scans. So there are a number of tests that can be done to actually look at things.
Thank you, Dr. Tayo. Okay, the next questions I'll take, a set of questions. Did you answer the how often is often for checkups?
Yeah, I did that. Okay. Talked about, colonoscopy being every year for certain age groups, and pap smear every 3 years or 5 years, depending on where you are. Yep.
Okay. So I think this next question is kind of embedded in that, because it says, what are the yearly checks? Most that this person is mostly familiar with the mammogram and pap smear. So I think the last answer you gave kind of takes care of that question. Okay. And now here's another one. I have heard that if you expose yourself early to the screenings, there will be a higher chance of exposing yourself to radiations and eventually cancer. How would you address this?
Ooh, let me think through this one. This is not unfounded.
I know three. I'm going to give you three questions. So while you're thinking through that.
Yeah. I'm thinking through that.
Okay. Now this one says, I know someone in the UK that was mistaken for fibroid for 3 years. Wow. So it happens everywhere. Misdiagnosis
exactly. Happens. Misdiagnosis is something that can happen anywhere.
Okay, someone is just giving us an information here that you can get screened for many common cancers in Nigeria, and says things like mammography, pap smear, colonoscopy, tumor markers, etc. Okay. This one says, is there any clinical reason or reasons why some cancers are more aggressive than others? So that's the second question. I hope you remember what the first one is.
I'm trying to remember. I think I know. I remember. Yeah.
Okay, so let me go back to that one. It says that I'm going to read it as it's written. I've heard that if you expose yourself early to the screenings, there will be a higher chance of exposing yourself to radiations and eventually cancer. How would you address this?
Okay, let's take them one by one. That way we don't miss any. That one, okay. Yeah, that one. I don't see why or how it can actually happen. Theoretically, it could happen, but in real life, I don't think so. The amount of radiation that a patient takes in from fairly almost all the scans, MRI, CT, and all those, the amount of radiation is not something that will harm someone. Even if you undergo so many scans. I mean, we have to understand that cancer patients, sometimes they have to go in for scans every week. So the cumulative amount of radiation they're receiving is not doing them any harm. The scans have been, the actual procedures have been, how should I say, designed in such a way that they're not loading patients with so much radiation that it could actually be the cause of another cancer. Do you understand? You're being checked to make sure you don't have one cancer. And then the modality by which you're being checked is now causing you cancer. I don't think that happens. So I think it's a worry that we can put to, we can put it to bed, to be honest.
Okay.
Yep.
Okay, I just want to add something to that quickly. Just about 2 weeks ago, so I had to take my mom to do some X-ray. Okay, and I was in the X-ray room with them, with her when she was taking it, and then the radiologist, if I'm right, went behind the screen to take it.
The radiographer would go behind the screen.
He didn't tell me to go behind it.
Yeah, the radiographer. That's the one doing the X-ray. Yeah.
Sorry. Yes, exactly. And said, and I asked her why she didn't tell me to go behind any screen. And she told me that I'm not exposed to it on a regular. That's what she does 24/7.
Exactly.
And that's the reason why I'm just trying to buttress the fact that I don't think we as patients do enough to get any negativity from it.
Yeah, but then I still think that wasn't very good practice. She shouldn't have left you in the room. That's all I would say.
Okay.
I mean, ideally, what she said it makes sense, because she's the one, as the radiographer, she's there every day. She's doing an X-ray, so she shouldn't be receiving too much of it. You are the only there, probably one visit, but ideally she should have made you come, either stay out of the room totally, or come behind the lead infused wall where she was staying. Yeah, ideally. But sometimes these people are just overworked and they will just do stuff. If you were not educated, and an uneducated person would not challenge her.
Yeah.
They would have just gone, But so I don't think that was very good practice. But again, I don't think whatever dose you received will cost you any harm. But it's not good practice.
Okay. Right. I think someone said they sent you a direct message, so you probably need to check your chats.
Yeah, that was a mistake. The persons, I think they meant to send it into the general chat room. And so when I replied them, and I'm trying to see if I can find the question.
Okay, so we redirected. Okay.
Yeah,
Let
if
me
it's
go to the next
personal,
question
I'll probably respond to them personally. Yeah.
So, okay. Now, this next question says, is there any clinical reason or reasons why some cancers are more aggressive than others?
It's $1 million question. Okay. That is still, Cancer UK is still looking into it. It's just unfortunate, yes, that we do have some cancers that are very aggressive, and we have some that are just very, very, very benign, but they're still cancers. Why this differentiation exists, I can't say, and I don't think there is any real reason that has, or very solid reason that has been brought out from all the science that's being done and everything. But what I can say is that when people are diagnosed with a kind of cancer, that level of aggression and of malignancy is something, it's an index that needs to be determined, based on historical factors and what is known about that kind of cancer. And of course, it is based on that then the caregivers, the healthcare practitioners, can then tell the person, these are the likely outcomes for you. So the exact reason why some are aggressive and some are not, it's not, I don't think there is any real answer to that. But I think the aggressive ones are usually of the nervous system. Aggressive cancers, usually more of the nervous system. And if they manifest in younger people, they're also more aggressive as opposed to the older people. So the exact answer is still in the air.
Okay, thank you, doctor. I have someone who wants to ask a question. She says it's quite long and typing is a major challenge. So I'll probably just unmute her.
Oh, wow. Okay.
And then, please. So maybe if there's still some questions, I think the doctor says she can still be with us till 8, right? Dr.
Yeah. 8 is my cutoff, unfortunately.
Okay, so if you have questions you want to ask, rather than type in the chat room, please raise up your hand. So Princess, I think that's the name. I'm going to unmute you now so you can ask your question, please. So,
Princess, unless maybe you just unmute everybody, Sister Toya.
No, I don't want to do that because everybody will ask questions at the same time, and then
I think we can ask them to take it in turns.
Okay, all right. Let me unmute everybody. Then we'll take it from there.
And so, if anyone has a question, I mean, there is one question I've seen in the chat box. Something about is breast cyst similar to cancer? And I'd say, yeah, it's easy to miss these things. Quite a number of them. I'd say no, but the point is we need to know what is in the cyst. So if someone has a cyst in the breast, most likely it's not cancer. However, I'm not going to put my money on that. The best thing is for the person to go get it checked. Probably they need to take a biopsy of the cyst or do a scan. Probably do a mammogram first to actually see the nature and the consistency of the thing, whether it's really solid in it or it has fluid contents. If it's got fluid contents, it could be, it's 50-50, but they need to get it checked. So if we know somebody like that, please, please, please let them go get checked ASAP. Cysts are more common in young ladies. I actually know that fibroadenomas is what the cysts are usually called. And they're mostly benign, but there is the tendency they could become malignant. And so we don't want that. So let's get that checked, please.
Okay. Princess, can you please ask your question? Unmute yourself and.
Hi, good evening, Dr. Tayo. Thank you so much. Seriously, well done. Apparently, in the course of the questions that have been asked on the chat room, you've answered some of my questions that I was going to ask you specifically to cervical cancer and breast cancer. So
right. Okay.
I won't want to waste your time again.
Okay.
Asking you the questions and then you repeating yourself. But one thing I don't know, Toyosi, it's well done for this Zoom thing that you did. And I think as a follow-up, I'm just going to suggest to you that you and Dr. Tayo should sort of like meet and talk about, start enlightening people, especially we in Nigeria here. Well, I'll say we because I believe I'm a Nigerian as well, even though I don't live here most of the time. But we in Nigeria as well, we still very, very the dark age when it comes to exposure, when it comes to us talking. Even a simple headache, you see some people hiding it. They don't talk about it, and they just suffer in silence. And I think it's about time, even if it's just maybe we people need to come together and have a flyer and tell that there's nothing to be ashamed of, right? That you've got cancer, that you've got AIDS, that you've got HIV, that you've got anything. There's really, really nothing to be ashamed. We need to move away from stigmatization, Oh, I'm going to be stigmatized, I'm going to do this, all those things. It's a lot of work. We need a lot of education. We need a lot of education and a lot of exposure. And if there's a way individuals like us, right, can come out and just keep talking, flagging it up, in every way we can do, one way or the other, we will reach some people. We might not reach everybody, but at least we will reach some people. Because people are just, they have tumor, they have stomach ache. How can you be having a stomach problem for 2 months and you are not checking it out? And then after that, you said, oh, she died. And by the time she died, it's cancer. It's just, I just believe just negligence. And there's a way you doctors and the likes of Toyo can help us. Thank you.
Thank you. Thank you so much. Adiola, that's you. I didn't even pick it. Yeah. Thanks, love. Thank you so much. Actually, myself and Dr. Tay we talked through this and said we'll watch from reactions we get here today, the frequency at which we can talk about things, especially those that affect we ladies. So we'll definitely take that up. Thank you so much. Thank you so much. Thank you so much for that. Thank you. And I'll use that opportunity to just put this out there, please. If you have comments and things you want us to talk about or stuff like that, please send them into my email, toyo.idris@gmail.com. I'll put that in the chat room right away. And please, you can also send us your email addresses as well. Send me your email addresses and then we can send you maybe the recording of this. I mean, some people will want to play it over. Someone left and sent a message that she would love to have the recording so that people can play it over and over and we can all learn from it, okay? Yeah. So I'm putting my email address in the chat room. This was just a spur of the moment, come to the mind, pain in my heart kind of event. And I'm hoping that we can take this forward. You can make it annually, quarterly, biannually, whatever, depending on the response we get. I would like to say I was quite scared of people probably not turning up for this or turning out for this, but we had over 50 participants. So I felt good, yay! So it isn't a bad thing at all.
It's not a bad turnout, yeah, indeed.
It is for and it was a short time frame.
Short notice, yeah.
Very short notice, and people.
Yeah. I mean, I just wanted to maybe say a quick comment in return to, I think, Princess, who spoke earlier on. Yeah, I mean, everything she said is what is reverberating in my own mind, in my own head. We just, as a people, that culture we have of being secretive about everything that's happening to us, it's killing us. I'm sorry to say, but it's killing a lot of people. Literally, it is killing people. And until we kind of disabuse ourselves, our minds from that, and speak out and learn to speak out. Yeah, fine. It's not everybody. It's not like you're going to carry a megaphone and go and start, broadcasting, I've got cancer to everybody, from the mountaintop and everything. No, but you need to be able to speak out to people. And as she said, it's a long road, but we will not, keep quiet. We'll keep getting the message out there that people need to speak out and seek help quicker, earlier, rather than later. Because as we said, detection, if you detect it early, the prognosis and the outcome is usually better than if it's detected late, further down the line. So yeah, it is definitely something on our minds. And everybody on this call, if one person, each one of us, we share with about 10 people in our circles, in our networks, that look, this thing where we are all so secretive and everything needs to stop, in our family, gatherings and everything. Let's encourage one another to speak up. When I came here to this country, and the people here would just tell me, oh yeah, my uncle had cancer, I had cancer. My next door neighbor here, actually right next to me here, I moved into this house 2007, and this lady said to me, we'd just be chatting in the back garden over the fence. Oh, and she was like, oh, I'm a cancer survivor. I was diagnosed with breast cancer the other day, and blah, and everything. I'm like, did I ask you? Because in my mind, I was like, why? Why are you telling me all your secrets? But the lady is still there now. 14 years I've been here. Her husband is close to 90. She's his carer. She's still looking after him. She's healthy because she had all, access to all the, the good care and everything. And she obviously picked it up at a good time. Her daughter is being monitored. Her sister is being monitored. So we just need to get out of this habit and culture mindset. Yep. That's all I really want to say also. And I'm speaking to myself too. I think I've got a couple of people who've raised their hands, but Sister Toya has stepped off. I don't know whether I can unmute them. I'm sure only she can unmute them. But yeah, we just need to continue. It's the same thing with, enlightening people about the state of the country. We need to enlighten them about the state of our health. There are a couple of people with their hands up, Sister. I think there's a lady called Olufumilayo Tijani.
All right. I think Fumilayo Tijani. Can you just unmute yourself and speak, please? Unmute yourself and speak.
Unless you unmute her. Maybe she's not. Oh, she's on mute now. Yep.
I have. She can
okay.
Doctor, good afternoon.
Good evening, ma.
Oh, sorry, good evening.
Yeah, it's evening here.
Yeah. Okay. Like for the breast feed, what my friend actually did was the 3D scan. Here in the US, they now have the 3D mammogram. I don't know if you heard about it in the UK. So she said she had a breast cyst. That was January, and they recommended that she go in 6 months after for another breast cyst. And when she went in last month, it was detected that the breast is still there, but it's like the reports they got is like the previous one. So there's nothing to be afraid of.
Okay.
So they told her that she's fine.
Right.
And when she was discussing with me, I was like, so if it is still like the other one, is it not cancerous? She said the doctor told her no. Okay. If it is not cancer, then can they take a sample of it? I think the name you call the sample is biopsy. Am I right?
Yeah. Yep.
Okay. So, because within our small community here, we Nigerian women, we
Sorry, where are you, ma'am?
myself and I'm in the US.
Okay. All right. I wasn't sure it was
Yes.
US or Canada.
No, US.
Okay.
So we try to talk to each other about the cancer program that the government was actually running. It was free. So we just tell each other about, have you gone for your test?
Yeah.
Some are like, no, me, hello, me, I don't want to go anywhere. I don't want to get any side effects. My auntie, she was alive. It was when she went to UK, they told her she had cancer. She died 3 months after. I don't want anybody to tell me anything. I don't want any side effects. But for some of us, go for this test, and behind the test, we have conversations about it. So it's the conversation I had with my friend that made me ask that breast disease, what exactly is it about? Then how can she go for a proper testing?
Yep.
For a proper testing with breast cyst to be
Okay.
sure that it's not cancerous. So although she's busy right now at work, so she's not part of this conversation. She would
Okay.
have loved to be part of it. Yes.
Yeah.
So any enlightenment you give me, or if I have I could take your number from Toyo on your email so that we can get in touch with you afterwards. We can have conversations so that you can guide her. Because here you can't just walk into the doctor's office. You need to book appointments. More so with COVID going around now.
Yeah.
No doctor wants to see anybody. Yeah. So that's just it.
Okay. I mean, I think, I spoke about breast cysts earlier on. First of all, I'll caveat it. I'm not here to give any medical advice because I'm not licensed to be able to actually do that for anybody. So please, let's keep that in mind. But I'm just sharing as sister to everyone here and brother, and those who are my brothers. But all I will say is for her to not relent on getting it all sorted out. I know the health system in the US is different from here in the UK. So I don't know how she can do it. If she doesn't have any symptoms, then maybe it's nothing. But I can't say, no one here can say. And as I said, I have my colleagues who are also doctors on this call. None of us is able to say we can't say. So she's the one who needs to pay attention to what her body is telling her. And if she has to go private to get another scan, as we said, second opinion, third opinion, get them until you are satisfied. Sister Toyo, she can verify to that. Get a second opinion, get a third opinion, wherever, she feels is necessary. Because I can't say, oh, she has to go and get a biopsy done. I don't know what's going on. But if she's not at rest, then she shouldn't rest. That's all I would advise. Happy to, discuss offline.
Thank you, doctor.
Yeah,
and
yes,
for
ma'am.
and for someone like me, my sister, although she's my half sister, she passed away 2019. She had breast cancer, and when I told someone, the person told me that, but she's your half sister, she's not your full blood, so why should you be bothered about that? Should I or should I not?
Again, I can't answer that specifically. It doesn't matter whether it is a case of you sharing mother or father. I don't know which it is in this case, but you guys are related by blood somehow. Now, the point is, it's not all breast cancers that are genetic. So that's why I'm saying I cannot say exactly what you should do. However, if you perform self-examination on yourself and you find anything, then you definitely need to get it checked. If, however, there's nothing, and if you know any history about the type of cancer that your half sister had, if she shared with you in detail about the type of cancer it was, whether she had the BRCA gene, which is one of the genes that could indicate that it's a genetic thing. If you know that, then I'd say yes, maybe you should chase this up. But otherwise, I cannot really say what you should do because I don't know the exact ramifications. I hope I've been able to help a little bit. Not sure if we have.
Yeah, thank you, doctor.
Okay, ma.
You unmute yourself and ask. Vera, unmute yourself and ask the question.
Okay. Dr. Hi. Good evening.
Okay. Hi.
Doctor, well done. A bit unwell. I didn't know I was going to be able to join.
Hello.
But luckily, I've done all the tests. Hello, can you hear me?
Yes, we can.
Yes, we can.
Yes, I've done all the tests. I've been ill for like 7 months, but I've run all the tests and it's nothing to do with cancer, luckily. But my concern for Nigeria is huge, and the concern for Nigeria, for me, is the fact that yes, with cervical cancer, we know through the cervix to do the test. With the breast cancer, it's through the breast and all that. Then you have other sorts of, I know, colon and all that, but there are other sorts of cancers in the bones and all that, So now here, outside of Nigeria, the blood work, everything, if you have to change your medication for blood pressure, in Paris, you must run blood tests, but I think there's a lot of guesswork. Where, doctor, through the blood, is it not possible to detect cancer from blood tests? Is it not possible? Because that is doable here. How come it's not possible in Nigeria?
Okay. Okay. Yeah, I think I know where your question is going. Yes, I was actually going to bring it up also, that a simple blood work. Okay, let me remove the word simple. An examination of the blood profile. So you can do different tests on the blood. You can do a test to look at the actual contents of the blood. You can do tests to look at the chemical components of blood. You can do tests to look at tumor markers in the blood. And so we have to differentiate all of those things. If you're just looking at the contents, the red blood cells, white blood cells, and all the other things in the blood, that's called a hemogram. That's a medical term for that. But if you're doing the biochemical aspect, it's called a biochemical assay and all that, you can see, how do I say? You can use some of these tests to try to detect if there is a potential for cancer in somebody. Then you can also use it to monitor. You can use this test to also monitor when cancer has already been established and diagnosed in a patient. You can use some of these tests to monitor a patient. But if it is not blood cancer itself, because you can have cancer of the blood, that's all them leukemia and all the myelomas and things like that, all these things that end with ma. Those are usually blood cancers or other tumors in the body, because you can have osteosarcomas and all that, bone cancers. But basically, if it's not cancer of the blood, you can't actually diagnose what cancer could be in the person just by looking at a blood work. I hope I'm making myself clear. So if it's not leukemia or something like a myeloma, you are not actually going to be able to diagnose that the person has a cancer. But you can have markers in the blood that can suggest cancer. And that then can sensitize a doctor or whoever the caregiver is to send the person for further tests. Now, I think those kind of tests should be available in Nigeria, where you just basically check for tumor markers. They should be available. They're simple, most of them. But I don't know if they may be expensive. Sorry, that's the last bit. They may be very, very expensive, especially in Nigeria, where, healthcare is, it's a private thing. And so people may not be able to do them or get them done. And so, yeah, it could be a big issue.
Okay, thank you. It's just unfortunate where people have alliances and they pay for health managers, health caregivers, and then when they go to those hospitals, they are told that their coverage, this cannot meet their coverage. So this is why people are dying.
Yeah.
If there is any way, I'll tell you, you know where I work? If
We've lost you. Oh dear.
Hello, Toyo. I'm just saying that Toyo knows where I work. If there's
Right.
any way we can speak, and then we can exchange some correspondences so that if there's a way to push some campaign. I mean, even if I can't give all the full blast of free for all and all that, if there's a way that I could approve some discounts and see how we can push some of these issues so that those who take our money and we have deductions, as civil servants, for instance, we have deductions monthly from our salaries because we have health caregivers. But then when you get to the hospital, what they just give you are some generic terrible drugs that don't even do anything.
Yeah. That's a reflection of the entire country, Auntie.
Oh, sincerely. All right, thank you, doctor. Wonderful job. I'll be happy to support in any way if I can.
Yeah. And, thank you so much also for being on the call with us. And one of my lovely colleagues here, Buki, he's Dr. Ajao, she's just commented in the chat room that yes, tumor markers are available in Nigeria, but I can imagine how much they cost to get done. So your average Nigerian, your lovely woman in the market, your market women, the petty traders, they're not able to afford a lot of these things. And so a lot of them actually just, they make up the numbers, the stats, the mortality stats. You're on mute, Sister Toya.
Okay, there you go. All right, Bumi A, you can unmute yourself. There's someone with Bumi A. He or she has the hand.
There's one Bumi and there's a Bumi A.
Yes, Bumi A.
Yeah.
So you can unmute and speak. Okay. All right.
Yeah, good evening. Good evening, everyone. And thanks. I'm going to be quick because it's almost 8. I just want to say, I think the problem that, picking about Nigeria that we're talking about this evening is that a lot of us, even myself, were aware of mammogram and smear tests. But the other test that you've mentioned this evening is new to me, and I'm sure it's new to a lot of people. And with Nigeria, if you don't walk into the doctor or the GP and say, I need this test, there's nothing out there to invite you to come in because of your age or whatever to say you're due this test. So if people are not aware of that test that they need to do the test, how would they just approach a GP to say that I need this test done? So I think it's more to do with awareness as well.
Yep.
Thank you.
Yep. You're very correct, Auntie. Thank you very much. That is why, this initiative was put together by Sister Toya. It's an awareness program. And, it has kicked off here. It can grow. It can grow and get bigger as much as it all depends on us and how we want this to go.
Yeah. Thank you, Bumi. Thank you for that. Thank you so much. You're right. Awareness is critical.
Thank you.
Awareness is really critical, and which is one of the reasons why I started this, because I feel that a lot of us just let it slip by. We don't bother, we don't know. And I think the most expensive, that there's a saying that the most expensive disease or most expensive something is ignorance. When you're ignorant of stuff, a lot happens. So in short, just like you said, these things are not things out there. I'll give you a personal whatever now. And just recently, I have this severe pain, stomach problems and all of that. My family members, my sister and all other people made fun of me that maybe I now have cancer because that cancer thing has become a family issue. Okay, I mean, ulcer, sorry, ulcer has become a family issue. And I said, no, I don't have ulcer. Anyway, I ended up in hospital for a couple of days. And at the end of it all, I was okay, came back home, but I was told to now go do a colonoscopy because, well, I'm over 50, you know, so I should go do a colonoscopy. I've not done it though, which is wrong, you know. I still haven't done it. Even my sister goes on about it. Toy, you need to go do this thing. You need to go do this thing. And I'm like, see me, I'm calling people to come listen to a program because I don't know what it is really, how it works, what it's like, if it's going to be painful or anything. So I told myself, okay, when I'm done with this program.
We can talk offline, sister.
Okay, darling. So when I'm done with this program, then I'll go do it, you know, then I know what it is. So I still have to do that. So I agree with Bobby. It's not something you can just walk into any hospital or any clinic and demand for it to be done. And it's not everywhere. You know, it's not everywhere. And then I'm throwing it out here to all of us in Nigeria, please. Even all these are so-called laboratories where we do all these things, we need to be very, very careful. I don't want to give out the name yet because I'm taking a legal action against one of these very big labs who gave me a totally extremely wrong report. Myself. It was while I had that problem before I was told to do a colonoscopy. And they gave me a report that was like, Emike. You know, it was totally, you know, when you know something that it's with you and they're telling you otherwise in the reports. And it was even the doctor that, my doctor that I'd had for over 20 something, almost 30 years. So the history is there. We know all that is going on. And you know, the funniest thing is that this lab did not even bother to tell me they're sorry or call me back in to come and do another test. And a couple of days afterwards, they sent me another report, a totally different report. So this is how these labs kill us here. So that's why I said, when you do something, do a check and another check and another check.
Get a second opinion. Get a second and third opinion.
Yeah.
Yeah,
So,
I mean, this is a problem that is perennial in Nigeria. So I don't know what to say, to be honest.
Yeah, so much mediocrity. Yes, ma'am. So much.
Mediocrity, that's the word.
Yeah, that's it. I just saw a chat now. Yeah.
Mediocrity is the word.
Oh, yes. Oh, I just saw someone just posted. Toyi, thank you very much. Very important screenings that need to be done at certain milestones in life. Maybe our team can organize a seminar around that. Oh, sure, we will do, which is why I've even given out my email address. Please, you can send us ideas on things you think we need to talk about and how the frequency. If you can send us, you all send us your email addresses. We're going to send out, I'm going to send out like a survey about this. I'm sorry I didn't have that prepared for this. This is the first time we're doing this. We'll send out a survey and we'll get your feedback and then we'll be able to know what to package next time. But the bottom line is to keep us healthy, to keep us safe, and to keep us alive long enough. We're all going to die. We're all going to die at some point in time because it is a basic that we all have to pay. It's a debt we all have to pay. But let's live long and in good health.
And healthy. Yeah.
You know, so that's the bottom line. So I don't know if anybody still has okay, I'm seeing email addresses. Okay, if you can send them here, fine. Otherwise, you can send them to my email. Okay, all right. I'm seeing email addresses popping up. But you can send them to my phone number. Let me I'll share my phone number. Send emails to 0802-775-7477, and you can just mention and then put Let's Talk Cancer in it so I know where it's coming from.
Yeah.
With Let's Talk Cancer as a rider. How do we say that? I think I'm right. That's the English word. Doki? Yeah.
Yeah, Benny, you're right, sir.
Cancer as a rider.
Right on.
So please, let's do that. I've sent that. I'm sending that out, and as well as my email again to you. Okay. So I'll send that out. Yes, I like this message. For some who know me on some of my platforms, like my secondary school platform, my primary school platform, my university platform, I always say it out there, let's exercise. I am a proponent of exercise. I always work, although I've not worked in about 2 months since I had all my negative scenario. It's knocked me in a corner.
It's taken its toll. So
yeah, so but I was hoping I would start again today, but probably I'll start tomorrow. I think doing this talk has gingered me in no way. So I'm glad. So let's eat healthy, let's rest well, and do a lot of exercise. Thank you, Olabomi. That's Tutu. Thank you, darling, for sharing that as well. I'm sure Dr. Tayo has to run. It's almost 8 p.m.
Yeah.
Barring any other questions, okay, let me see if there are any other questions.
I'm trying to see if I can pick up that one that was sent to me via a direct message. It's way,
okay, please check.
Yeah, I'm going to see if I can fish it out. Don't want it to seem like I'm ignoring the person.
Okay.
It's still.
Thank you, everyone. Thank you, everyone. Thank you, everyone. Thank you, everyone.
Oh, I think that's the one we talked about it. It was
okay. Maybe she put it on the general.
She eventually did. It was from somebody called Bomi.
Okay, yes, that's my okay.
Yeah, she put it out, which was the one about why some cancers are more aggressive than others. So
okay.
We've addressed
it.
Okay.
Oh, she's even responded. You answered it already.
Yes.
So
yes.
Thank you so much, everyone. I would like to say, first and foremost, I'd like to say a big thank you to Bolanle Tayo. She's just a lovely person. I initially wanted to have this at a particular date, and it was just the date was too early. It was just, I gave her just a day's notice, and it was like, sis, if you want me to do good justice to this thing, I need at least a week or two so I can put this thing together. And from the comments I can see so far, I see that we've all been blessed. And even out the 2 weeks to be able to do this has really worked in my favor and in everyone's favor. We've learned a lot from her, and we hope that we'll be able to take this on. Take it forward and do more and more of it. So, Bolanle Tayo, thank you so much, Doctor. My Doki Olola, that's what I call her. Doki mi Olola.
Mami Toyosi.
So thank you so much. Yes, so thank you so much for this. And to everybody that has tuned in, I would like to say thank you so very much. Yeah. May you never know the loss of a loved one, especially when they are quite young. May we never, I don't ever want to go through this again.
Amen.
And there are 2 people on this forum right now who are, I won't mention names, who are direct, what directly happened to them. So I'm going to thank them both for being on this forum. Thank you so much. Thank you so much. Thank you so much. The Lord will comfort everyone. The Lord will comfort everyone. So I would like to bring this to a close by wishing us all well. Thank you. And please don't forget to send me your email addresses. You can drop them. I've dropped my email address as well as my phone number. So please, when you send me an email or the phone, send me an email via email. If you send me your email addresses via email or via the phone number, please, for the email, put the subject as Let's Talk Cancer. And for the phone messages, just put Let's Talk Cancer beside the email, beside the message, so that your email address, so that I know exactly where this is coming from. So once again, I'd like to say thank you. Have a wonderful evening and a fantastic week. And the rest of the year as well. May we not have negatives, and may it all be well with us. By God's grace. Thank you so much.
Thank you. Thank you, everyone.
Bye, everyone.
Thank you. Bye.
Bye. Bye.
Bye.
Bye.
Bye-bye. I'm ending it. Bye.
Bye, Tata. Bye.
Bye. Thank you, loves. Thank you so much. Miss Olatuji.
Thank you.
I see you. I see you. Unta, thank you. I see you. Thank you so much.
Yes, so,
Thank
Daddy
you.
was watching you. Daddy was watching you, Tata.
Hey, yeah. Oh, Daddy.
Yes, he's watching you.
Oh, thank you so much. My love to him, please, Unta. Thank you.
Look at him.
Hey, Daddy. Good evening, sir. Good evening, sir.
Good evening.
Good evening, sir. Thank you.
Hello.
Yes, sir. Yes, sir. God bless you. God be with you, sir. God be with you. Bye. Sir, thank you. Bye-bye.
Thank you. Bye, love.
Bye, darling. Bye. Bye. Bye, everyone. I'm ending the meeting now. Thank you. Bye-bye.
bye, Toy.
Hey, Kura. Bye-bye.
Bye. Bye.
Bye, bye, darling. Bye-bye. Bye-bye. Oh, goodness. Damilola, I see you.
Hi, Mark.
Hi, darling. How's my baby boy?
I'm doing very well.
Good, good. Thanks for tuning in. Thank you so much, everybody. Thank you.
Have a good night.
All right. Bye.